Now, next thing that we will be covering is about the acquired immunity. And when we started this chapter of immunity, I have told you that immunity is of two types. What are the two types? You have innate immunity and you have the acquired immunity, right? So innate immunity was present since birth, and acquired are the skills that you acquired throughout your life, right? So acquired immunity. Acquired immunity is immunity that develops after the exposure to specific antigen. It is the immunity that develops after the exposure to certain antigen. If I give you the example can be of chickenpox. Chickenpox. First, you are infected with the chickenpox, right? And also tell me which mosquito causes chickenpox. Chickenpox is not caused by chicken, okay? So you got infected with chickenpox, and after a certain period of time, when the incubation period of chickenpox get over, you are well, and now you will not get that infection throughout your life. Throughout your life, you are protected from that infection, right? So that is what it is written, that acquired immunity is the immunity that develops after the exposure to specific antigen, and it is highly specific, okay? It only allows the high profile people. It is highly specific and has memory because it is able to recognize that what is self and what is non-self, right? So it has a highest memory. Now let's understand the characteristics of acquired immunity. What are the characteristics that acquired immunity have? First one, it is very, very specific because it targets the specific antigen only, and it recognizes and eliminates foreign substance while sparing the self antigen. What I told you, that it targets the specific antigen only. Just like when we give our vivas, some of the professor may target a particular bunch of students. Just like that, acquired immunity targets a specific antigen, okay? And I'm so sorry for this, but that was just a joke. Second thing you have is the diversity. Now, diversity, you will tell me what is diversity? Diversity means a bunch of million of things that are very different. Just like India. India is a diverse nation, right? So, diversity means it can recognize million of different antigens. Not just the specific one, it can recognize what are the other antigens that are available. Third, it is memory. Third is the memory. That is, it enhances the response upon the re-exposure to the same antigen. Just like I told you, I have given you the example of chickenpox. If you got infected with chickenpox once in your life, then for the rest of your life, you are immune from getting chickenpox, right? So the basis is of that of a vaccination. Because if you are pre-vaccinated, if you are pre-prepared for something, like if in this class I conduct a surprise test of pathology, then there will be certain bunch of people who already are very well versed with the subject and they know each and everything about the subject. So they will pass this test with flying colors, right? So they are pre-prepared. Just like this, when you get vaccinated, like if you are getting vaccinated for tetanus, if you are getting vaccinated for tetanus, so tetanus gives you a protection of whole 5 years, right? Fourth one is the self and the non-self discrimination. It avoids attacking its own tissue under the normal circumstances. It does not attack the self tissues. Fifth one is the lag phase. Okay, so in the bacteria, you have certain phases and you will learn about this in your microbiology. But let me just give you an overview of the phases. You have the lag phase, then you have a log phase, then you have a stationary phase, and then you have a decline phase. Okay, so if I draw the diagram, it will be something like this. This is your lag phase, This is your log phase, the most active phase. Then is your stationary phase. And then is the decline phase. So it is very much advised that you should be in this stage, the log phase. Because if you go into the stationary phase, then there are high chances that you will end up in the decline phase. So you should always be active and always be in your log phase. Okay. Now, next you have is the type of acquired immunity. The types of acquired immunity. You have two types, active and the passive. And now I will give you an example so that it will be very easier for you to understand. An active immunity is, let's suppose you pass your MBBS with flying colors. Then one day you decided to join as a medical officer in some colleges, right? So you got appointed in that hospital as a medical officer or an RMO. So your job is from 9 a.m. to 5 p.m. and sometimes you also have the night shift, right? You have to go from Monday to Saturday and sometimes even on Sundays, 9 to 5 hospital job. So you are actively involved in that, right? And if I give you the example of passive, so what's happening in the passive one? In the passive one, it's like you decided to publish a book. You published a book and when that book will be sold, right? So whatever amount of commission that you are getting, you will be getting that commission throughout your life, right? So you should do something passive work as well in your life. Active immunity develops by body's own immune system. As I told you, you have to be actively involved in your hospital duties. Then it results in memory cells giving long-lasting protection. You have the two types. What are the two types? Natural and artificial. Natural is by the natural infection like the chicken pox. I have already given you the example. Second one is artificial. Artificial is via the vaccination. And the very well example is polio. Because if you don't get vaccinated, if you don't take the OPV, the oral polio vaccine, then there are highly chances that you will end up into the polio paralysis, right? And it's very, very dangerous. So, this is the example of the immunity which is provided after the polio one, right? Next you have is the passive immunity. Okay, before jumping onto the passive immunity, tell me, what is the schedule? According to the National Immunization Schedule, at what age does polio drops are given, and whether it is IPV or OPV which is given? Tell me. Next you have is the passive immunity. So I have told you the example of passive, that is publishing a book, right? So you should publish a book on my life, not my life, in your life, so that people will be more interested, because people are more interested in knowing about some other people's life. Anyway, coming to the passive immunity. Passive immunity is the immunity which is acquired by the transfer of pyriformed antibodies. They are acquired by the pyriformed antibodies and they do not involve any host immune system and they are very short-lived. What are the types of passive immunity you have? You have the natural passive immunity and you have an artificial passive immunity. So in the natural passive immunity, you have the maternal antibodies. IgG across placenta and IgA in the breast milk, right? So what are the types of IgG you have? What are the types of immunoglobulins you have? What are the types you have? You have the G, A, M, E and D. You have this much type of immunoglobulins. Next is the artificial passive immunity. Now the artificial passive immunity is by the injection of the immunoglobulins like the anti-rabies and the anti-tetanus. I have told you that tetanus gives a protection up till 5 years, right? What is the dose of rabies? Not the dose, tell me the days. How many days it is given? I guess it is given for 5 days, right? It is a 5-day and a 3-day course. 5-day and a 3-day course that you have for rabies, right? Now, moving on to the next one. Next you have is the cells involved in acquired immunity. What are the cells that are involved in acquired immunity? So, you have the B lymphocytes and the T lymphocytes, the B cells and the T cells. So, B cells are basically for the humoral immunity and T cells are basically for the cell-mediated immunity. And we will read about humoral cell immunity and the cell-mediated immunity when we move forward in this chapter. Now, so B cells are basically the humoral immunity. They originate from the bone marrow. B for B, okay? B lymphocytes, B cells and bone marrow. They are activated by the antigen or the helper T cells and produce immunoglobulins from the plasma cells and memory B cells. So T cells, they basically are the cell-mediated immunity. They are basically the cell-mediated immunity and they mature in the thymus. They mature in the thymus. What are the types you have? You have CD4, CD8 and regulatory T cells. And these are basically the ratio of CD4 and CD8 helps in differentiating the infection. If it is decreased, it indicates the person is having HIV, and if it is increased, it indicates the person is having the infection of sarcoidosis. Okay. So, the types that you have is the first one, CD4 helper T cells. They stimulate the B cells, macrophages and the other T cells. The CD8, they destroy the infected cells and the tumor cells. Whatever the tumor cells that are available, they destroys that. Then you have the regulatory T cells. They suppress the immune response and prevent the autoimmunity. They suppress the immune response and prevent the autoimmunity. Next that you have is the antigen presenting cells, the APCs. The APCs that you have. So they are nothing but the macrophages, dendritic cells, B cells. They process and prevent the antigen with the MHC. What is MHC? I will tell you. Next that you have is about the mechanism of acquired immunity. So what is happening? I have told you there are two types, humoral immunity and cell-mediated immunity. So what is happening in the humoral immunity? That is the B cell mediated. The antibody binds the antigen. They neutralizes the toxins and enhance the process of phagocytosis. What is happening? Wait. The antibody basically binds to what? To the antigen. And they neutralizes. And they neutralizes the toxins. They neutralizes the toxin. Okay. Now what is happening? It is effective against the extracellular pathogens like the bacteria and the virus. If any sort of bacteria or any sort of virus enters into the body, this system gets activated and it tries to kill that. So you have certain immunoglobulins. I have told you what are the immunoglobulins. You have M, G, A, E and D. So M is the first response and it is a pentamer structure. Okay. And it is a pentamer structure. It is also massive type of immunity. It is also a massive type of immunity that is present. Okay. M for massive, remember. Now, IgG is the most abundant and it is of memory response. IgA gives you the mucosal protection. IgA gives you the mucosal protection. IgE gives you the allergic. See, allergy has a letter E in it, right? So IgE is for allergic responses. Now IgD is for the B cell receptor. IgD is for the B cell receptor. I will tell you with the help of an diagram also, with the help of a flow chart, we will summarize all the points that we have discussed. So don't worry. Yeah. Next you have is the cell-mediated immunity, that is the T cell mediated. So they do not involve the antibodies. They are effective against the intracellular pathogens. The humoral immunity was activated against the extracellular pathogen. Now they are activated against the intracellular pathogens. They are cytotoxic T cells and destroy the infected. The helper T cells basically release cytokines like interleukin 12 and interferon gamma. Okay. Now, the body has certain responses like the primary response and the secondary response. After that infection got over and or is happening inside the body has certain responses like the primary response and the secondary response. So, the primary response is basically of 5 to 10 days, whereas the secondary response is 1 to 3 days. The antibodies that are involved in the primary are the IgM and IgG, whereas in the secondary it is only IgG. The antibody concentration in primary is low as compared to the secondary one, wherein as in secondary one it is high. The memory cells are not present initially in the primary but are present and activated in the secondary immunity. The duration is primary is short-lived and secondary is long-lasting. Now, next thing that we will be studying, before jumping on to the next thing, wait. I'll show you that flow chart. Yeah. So, this was about the mechanism that was happening. What is happening? See, the antigen first enters the body. The antigen presenting cells, they get activated. What are the antigen presenting cells you have? You have the macrophages and you have the dendritic cells. So what they do? They activate the helper T cells. They further activates the helper T cells. And these helper T cells now releases the cytokines. And then there is the B cell activation, the amplification of immune response and the cytotoxic T cell activation. So in the B cell activation, the plasma cell produces the antibody which neutralize and do the process of opsonization. And I have already told you, I think we have discussed about opsonization n number of times. So it's not necessary to give opsonization that much of importance in your life, okay? And you should not give anyone this much of importance in your life that we have given to opsonization, right? So there is memory B cells and the T cells that are formed. Next is about the immunological memory. So what is happening is, after the first exposure that has occurred, after the first exposure, like when you are getting infected, after that the memory B cells and the T cells persist. The memory B cells and the T cells persist, and when there is a re-exposure of that organism, they rapidly multiply and generate a strong response. They are like, now we don't want that microbe to come again, right? Like there are some relatives whom you don't like. So you prepare yourself in such a way that whenever that relative will come to your house, what you will do, you will not meet or greet them properly. But you should not do this, okay? It is not a good habit. You should always respect everyone. So this is on the basis of vaccination. Guys, please don't take whatever I'm saying seriously. Now, you have the hypersensitivity reaction. See, hypersensitivity reaction when we are complete with the acquired immunity now, because now I'm telling you a brief about the acquired immunity, then I'll tell you about the cellular immunity and then the humoral immunity. After that, in detail, I will be covering about the hypersensitivity reaction, right? Hypersensitivity reaction of 4 types. Actually, there are 5 types, but We are just studying the 4 types only. You have the 1, 2, 3 and 4. So, one is immediate allergy and it is IgE mediated. One is immediate allergy and it is IgE mediated. 2 is cytotoxic and it is IgG or IgM mediated. 3 is immune complex disease and 4th one is the delayed type of hypersensitivity. You don't have to put your head into this right now because we will be understanding about this in detail as well. This is just an overview which I have given you, okay? Now, next thing is clinical relevance because we are clinicians, right? So, it's very necessary to write about the clinical relevance. So, the first clinical relevance is about the vaccination. What it is? The artificial active immunity preventing the infectious disease. So, vaccination is very, very important. Your pre-preparedness towards everything is very, very important. So, you should be pre-prepared in your life of whatever the situation is. You should always be pre-prepared. Okay. Next is about the immunodeficiency. So, immunodeficiency, there is defect in the acquired immunity which results in frequent infection. If there is any sort of defect that is occurring in the acquired immunity, so you will be getting frequent infections again and again. You will get infected. Okay. Third thing you have is about the autoimmune disease. So, in the autoimmune disease, it is the misguided immune response against the self-antigen, like in cases of rheumatoid arthritis. And since you are clinician, I'll also give you the treatment. What is the treatment of rheumatoid arthritis? You will give methotrexate. You will give methotrexate. Okay. You will learn about rheumatoid arthritis in your medicine lectures as well. Okay. So, don't worry. Fourth thing that you have is the organ transplantation. See, organ transplantation requires immunosuppression to prevent the rejection. Okay, it requires the immunosuppression to prevent the rejection of that organ. Fourth is the organ transplantation. Okay, I have told you. Fifth one is about the allergies. So, excessive immune response to harmless substance. Okay. Excessive immune response to harmless substance. This was all about the clinical relevance that I have given you. So, if this acquired immunity is asked as a short note, or the long note, see if it is asked as a short note now. Write the definition. Write about the characteristic, only the headings. Okay. Then about the types of acquired immunity. Then the cells that are involved, that is your B cells and the T cells. Then explain about the mechanism, this flow chart that we have, that I have told you. This flow chart, this flow chart is very, very important. So, you should explain this flow chart. Okay. We have come to a conclusion, and obviously, if it is a short note also, you have to write the clinical relevance because we are clinicians, right? So, you have a mnemonic. The mnemonic is specific, that is the mnemonic of acquired immunity. It is very much specific. It has programmed memory. It evolved from the exposure. Once the exposure will occur, then this immunity gets activated. Then is the cell, you have the cellular and the humoral response. Then is the immune diversity. Then you have the faster secondary response. Then is the immunoglobulin production. And C is for the chronic or the acute reaction. And we have seen that what is chronic and what is acute. If the duration is less than 6 weeks, it is acute. And if it is more than 6 weeks, it is chronic. So remember the mnemonic of specific. Acquired immunity is specific, and specific covers all the characteristics that are there in your acquired immunity. Now let's solve some of the MCQs. Okay. So first MCQ that you have is, which of the following cell is primarily responsible for the antigen to T cells for presenting antigen to T cells. Is it the neutrophils? No. Is it the platelets? No. Is it the RBCs, the erythrocytes? No. So your answer for this becomes the macrophages. Your answer for this becomes your macrophages. Then next is MHC class 2 molecule present antigen to which of the following T cells? MHC class 2 antigen presents the MHC class 2 molecules present the antigen to which type of T cell? Is it the cytotoxic T cell? Is it the helper T cells, B cells, or the plasma cells? So the answer to this is the helper T cells, that is your CD4. So this was all about the introduction to your acquired immunity.